we're going to start with welcoming the patient in. I have pre-booked the patient for somewhere between 1.5 to 2 hours, depending on the complexity of the crown that we're intending to prep that day. Update your health history, get your consent ready. My assistant's doing all of this while I'm either doing a hygiene check or maybe just frankly watching a funny YouTube video, so that I can come in and start moving forward with the procedure. We always start by setting the expectation with the patient that they may walk out that day with a temporary crown, that biology is the ultimate dictator of what the decision will be at that time. It is our goal and expectation to try to do same-day dentistry, but we're not always that lucky. And sometimes the technology fails us as well, and we have a glitch or an issue with the technology, and we just have to punt and say, today is a temporary day. And so if we set that expectation from the beginning, and if the patient is dead set that they only want to get started with same-day dentistry when you can guarantee that will happen, then that might not be the best patient to try the digital workflow on. So the appointment will move to the anesthesia appointment. The dentist is obviously in the clinic at that time. They're coming in, greeting the patient, confirming the procedure to be performed that day, reiterating those expectations. Then we're going to place a nice healthy dose of tack, and I'll let the patient know that now the assistant's going to be stepping in to prepare a few things for us to get us ready for this appointment. They can go ahead and do their pre-operative scanning. We can go ahead and scan the opposing arch. We can scan the treatment arch. I usually will scan up to the mesial tooth and distal tooth of the tooth or teeth that we're working on for that day. If it's a big arch scan case where you're doing multiple units, I probably won't touch the treating arch at that time. We'll just get it all at that last scan. But if it's a single unit crown, I definitely can go ahead and get enough to get a buccal registration captured. All of those things are done before we prep the tooth. You could look at occlusion at that time, get a better assessment for what you may be walking into if you have challenges with the case. And then I'm going to delegate the remaining manufacturing steps to my team. That's the visualization of the margin that we want to see. You can see margin, and then you can see tooth beyond the margin. It makes your job as a clinician much more predictable to identify it. And then we're going to move it into our design software, so that we can start highlighting where that margin is located. If you're using a third party, some manufactured milling machines come with their own software. You could use exocad if you wanted something that was like a third party design software. So lots of different options that you could consider. If you had a lab that could turn it around for you in 15 minutes, you could certainly send your STL file to a lab and have them return a design back to you to mill in your office. Production time is going to take anywhere from 15 to 35, if it's zirconia, maybe closer to 45 to 50 minutes, depending on the material choice that you choose. So we know our zirconia cases are going to take a little bit longer than maybe our other porcelain options that we have. So this is a clinical case that we did. The pre-case looked like this: large existing composite restoration with multiple fracture lines. The patient was starting to become symptomatic. So we removed all the old material, removed any decay and the fracture lines that we could find, and then proceeded to move forward with scanning. Now, this was a deep, just below crest margin on the distal of this upper molar. So we debated, we kind of discussed it back and forth. Is this a retraction paste case or not? Decided to give it a whirl and see how it would do. We could always go back and pack cord if it didn't work. Let it sit for a few minutes, and then we were able to very successfully visualize that margin. We move it into the scanner at that point and confirm that we have good visualization of where the margin is located. And then we can move forward with manufacturing of that as a same-day restoration and provide stability back to that tooth within the first couple of hours of working.